Good morning, good afternoon. My name is Shakira Diaz. I am the Chief of Federal Advocacy for the Alliance for Safety and Justice. You are joining us for the Scaling Safety webinar, a roadmap to close America's safety gaps. We are going to focus this morning on a few goals. We're going to elevate those. You're going to hear from some amazing folks. We are going to be discussing a report that the Alliance for Safety and Justice recently released, highlighting the safety gaps in the country and how to scale them up. We're going to hear from leaders of innovative programs and how they fill these gaps and what they need to bring these approaches to scale. You're going to be hearing from our facilitators, which include myself, this is me, and the president of the Alliance for Safety and Justice, Lenore Anderson. Next slide, please. You're also going to hear from our amazing innovators. These are the folks who are in communities across the country working really hard to fill that safety gap, to ensure that communities across the country experience stability and safety. You're going to hear from Akila Sherrills, co-founder of the community-based Public Safety Collaborative. You will hear from Susan Burton, founder of A New Way of Life. You will hear from Allison Simmons, executive director of the Central Iowa Trauma Recovery Center. And last but not least, you're going to hear from Stacy Wigall, Director of Technical Assistance Programming for the National Alliance of Trauma Recovery Centers. Thank you. And I want to kick it over now to Lenore Anderson.
Hi, good afternoon / good morning, everyone. Thanks so much for being here today. So our goal is to provide you with an overview of a new report we released called Scaling Safety, a Roadmap to Closing America's Safety Gaps. We can put a link to that report in the chat if you haven't seen it yet. This was a report that was driven by trying to answer a key question. And the key question that drove us to put this analysis together is what kind of investments are needed to equip communities with capacity to prevent the cycle of crime. This is experimental. We hope that this is a door opener and something that can start a conversation with many of you on this webinar today. You can go to the next slide. So it's a first of its kind analysis. Our aim was to see what it would look like to use ratios to estimate the investments that communities need in community safety programs. So by that, we'll talk a little bit about what we mean by ratios. But essentially what we were thinking about was, could we put out there for discussion and adoption, essentially a baseline of what all communities need to be equipped to effectively prevent the cycle of crime? And with that in the back of our minds, that's how we came about with these proposed ratios that we're going to talk about today. So in terms of why now and why ratios, you can go to the next slide and we'll talk a little bit about what's happening across the country that many of you on this webinar know all too well. So we're living in a time in which people across the United States are increasingly concerned about crime and violence. Much of the concern is warranted when you look at shifts, particularly in gun-related homicides across the country. This is a time where, 10 years ago, there wasn't as much public discussion around crime and violence. It's now top of mind for many. What's critical in this moment when it is top of mind is to make sure we don't fall back on some of the old ways of of doing business that really did not equip communities effectively. So a lot of public safety investments for the last few decades have focused on the justice system without enough attention paid to what it takes at the neighborhood level to prevent crime. Meanwhile, neighborhood leaders have been brick by brick building those solutions too often without the kind of support that's needed to scale them to meet community need for these programs. These are programs that are having a strong positive impact on preventing repeat cycles of crime and violence. We'll talk about 3 of those models today. And these are also community-based public safety programs for which there's a huge amount of public support. When you look at what the majority of voters think would make a difference in stopping and preventing the cycle of crime, these are the kind of programs that rise to the top. So, the question then is not what do we need to do to effectively address crime and violence at the neighborhood level and build out that prevention infrastructure. But the question is really, how much prevention infrastructure do we need? And that's really where we were going with this report. So next slide. We wanted to start to flesh this out concretely. And we thought that it would be good to take some cues from other sectors that are funded by public resources and look at how have other sectors scaled up in providing essential services to communities. And what we found is that per capita assessments of what communities need to be healthy and strong have been instrumental in other areas of government in terms of prioritizing what government invests in. And you can just look briefly at a couple of these other areas and see how relevant this idea of per capita assessments can be. So in the realm of education, in the 1950s is when the student-teacher ratio became a common talking point and a common discussion in the development of education investments. That's had a major impact on school investments and become a metric by which the health of schools and the strength of schools is determined. We can also look at health and housing. In the world of health, there's a ratio that the federal government uses for the number of physicians needed per 10,000 residents. And that has driven funding toward reducing or ameliorating areas that are considered medically underserved. In the area of housing, there's increasing awareness of ratios as it relates to how much affordable housing is needed per 10,000 and 100,000 people. And this is a metric that is increasingly being used to expand affordable housing across the country. So, in looking at these other ratios and applying that same logic to crime prevention, we thought we'd give it a go to see what we could learn and what we could potentially propose as ratios for crime prevention infrastructure and building it out. The first question that you have to answer in order to get to a suggestion around ratios in community-based crime prevention is, what do we know about what that gap is? What is the current gap as it relates to that cycle of crime and violence? So on the next slide here, we'll just give you, our headline in terms of how we think of and conceive of this cycle of crime and violence that is eminently preventable and interruptible. And what we know is that when communities are not equipped to address crisis, that crisis instead can often be neglected and devolve into crime. So when we don't invest enough in that crime prevention infrastructure, when government investments do not really allow communities to effectively address crisis, we see that crisis contribute to the cycle of crime and violence. And that's what we mean when we talk about building out that prevention infrastructure. That's the cycle that we're trying to address. This is a cycle of unaddressed trauma. It can be a combination of other factors that are happening that drive that cycle. But it is, again, it's eminently preventable and interruptible. We just got to scale up and equip communities with the support that's needed. So, there are, and many of you on this webinar are running some of the top-notch programs in the country that can do the work to stop that cycle of crime. We, for the purposes of beginning a conversation around ratio-based thinking in public safety, we pulled out 4 key sort of program offerings that make a strong positive impact that are also underfunded and underinvested in. There are others above and beyond this, but we just wanted to start with these 4 core ones that represent the ones that we hear the most about. I know a lot of y'all are familiar with Alliance for Safety and Justice. We organize survivors of crime and people with old records across the country. And so we hear a lot about what the gaps in safety are from our members. These are 4 that come up the most. The first is when youth and young adults are not supported, it contributes at the neighborhood level to crime and violence, but you can build violence prevention services that effectively mediate conflict, provide mentorship and connections, and you're going to see neighborhood violence go down. Victim services. We know that when victims are vulnerable to becoming, when they don't get help in that moment of crisis immediately after being hurt, they're vulnerable to becoming victims again or getting involved in the cycle of crime and violence. Trauma recovery services, other crisis assistance services for victims can stop that. Reentry services, similarly, we know that there's a moment of vulnerability when people leave the justice system. That's an opportunity to offer stability. Offering stability in that moment reduces the likelihood that repeat crime occurs. And then, of course, there's the mental health crises that's received increasing and deserved attention, which is that we know that too many of the calls for services that come in to 911 and police are related to mental health crises, but there's inadequate support to resolve those crises without justice system involvement. So with that kind of long-winded background, thanks for bearing with me. I just wanted to give y'all a sense of our thinking behind the thinking here. We assessed the rate of victimization that's happening. We assessed the availability of transitional housing, the number of people returning to communities from the justice system, and we've come up with some key findings. So what you see on the screen here is, our proposal on what ratio-based crime prevention infrastructure building would look like. So, for every 100,000 residents, we propose that there needs to be a significant scale up of responses to address trauma and instability for survivors of crime. Number 1, that looks like a minimum of 1 trauma recovery center, DV and civil legal, DV shelter support and civil legal services. We think for every 100,000 residents, there needs to be significant scale up of interventions to prevent violence, often referred to as CVI, crime, community violence intervention. The other area is mental health crisis response, mobile crisis response teams, scaling those up significantly. And then reentry programs, especially those that support transitions into employment and into housing, scaling those up significantly. I want to reiterate, this is at minimum what we think that communities need per 100,000 residents. Our hope is that there are many more programmatic interventions that go a long way towards stopping cycles of violence and harm, and that those can be added to this idea of ratio-based investments. So the next last couple slides before we open it up and discuss, This one here is just a summary of what the prior slide said in sort of the highest bullet point terms that we could come up with here, which is that per 100,000 people, we think that communities would need at least one trauma recovery center, at least 20 domestic violence shelter placements, at least one organization providing civil legal services to survivors, at least 25 community-based violence prevention outreach workers, one youth program with capacity to serve at least 1,000 youth, crisis response team that can handle at least 2,800 referrals for service, 7 reentry navigators, and 60 transitional housing placements. Now, I just want to put a pause here. And for those of y'all who work in government or in neighborhood community violence, when I look at these numbers, my first reaction is that is a lot more than we have today. That is a lot more. Even in some of the most invested in parts of the country, cities with a lot of infrastructure for these types of programs, we know of nowhere in the country where they are invested in at this scale per 100,000. So that means if you have a city of 500,000 people, that'd be 5 trauma recovery centers at minimum, right? That would be able to, support that community. So this should hopefully spur some increased investments. There's a lot of money flowing now towards public health, which is long overdue. There's federal dollars coming into states and cities. This would be a great time to scale up at this level. And the public supports it. The last slide here, public opinion research shows strong support. 8 in 10 voters support all of these 4 core programs. And there's strong majority of support across a wide range of demographics, whether that's party affiliation, age, race, ethnicity, income, or region. So with that, let me hand it back over to you, Shakira, to bring in our experts.
Perfect. Thank you so much, Lenore, for that. So we're gonna giving you all some time to process that amazing information. We want to transition to the folks who are actually putting this into practice. I live in a part of the country where it snows. And in the fall, there's often these conversations of, do we have enough salt? Do we have enough snowplow trucks? And the reason is that government is working proactively to mitigate any potential and reduce any potential disasters that could come about from things that we know will happen. These folks that are joining us today are like the snowplow drivers of public safety in their region. They're making sure that there are supportive services available and that they're stopping the cycle of crime and violence. I want to start off with 2 folks here who are absolutely amazing. I want to start off with Stacy Wagall and Allison Simmons, who are going to talk with us a little bit about the Trauma Recovery Center model. I want to start off first with start off with the primary question is, what does the Trauma Recovery Center model do?
Sure, well, I can jump in on that. Thanks, Shakira. The Trauma Recovery Center is a one-stop shop to address the psychological and practical impacts of violent crime. And TRCs exist to fill the gaps in traditional victim services and mental health services, because most victims don't end up receiving any kind of help or support after crime, especially those from underserved communities. So TRCs provide wraparound comprehensive care. The model includes assertive outreach. It includes case management and care coordination, navigating complex systems, and also high quality mental health treatment. So TRCs cast a wide net throughout a community to be able to engage victims at different points of entry, rather than waiting for victims to seek out services. Points of entry include hospitals, schools, law enforcement, emergency shelters. And TRCs also provide evidence-based mental health treatment. So they're targeting the symptoms of distress that commonly arise from trauma, such as PTSD and depression. They're supporting safety and stabilization. But TRC staff are also helping address the practical needs that are often at the top of the priority list for many victims. So when someone says, I can't pay my rent because I'm afraid to leave my house and I haven't been able to go back to work, that's a mental health issue, but it's also a safety issue.
Right.
It's destabilizing for that person, for their family, for their community. And when individuals and families are able to access the help and services they need to recover from violence and begin healing, that spreads healing throughout an entire community. That's changing safety in the communities most impacted by violent crime.
Allison, what would you like to add here? Particularly from what you're seeing from your standpoint.
Well, first, when I'm just taking in all of the comprehensive data and information that went into this report, when you hear it, it's just like, wow, there's so much there. And I think about, the work that we're doing, and not just us at the Trauma Recovery Center, but with the organizations that are represented here. I think about what's possible. This report makes me think about what's possible. If we make this investment, this is what can be realized across the country. We are providing, as Stacy had indicated, we provide mental health and clinical care coordination on site and medication management on site. So when you have that individual that is referred to the center, we can immediately begin treating them. We can do bedside consultations. We can go to their homes. It's just an assertive component to respond to a survivor of a violent crime. And so that's one thing that I thought about as I was hearing, all of the different options that recommendations, I should say, that are coming from this particular report about what is possible in our community.
How are
And this-
TRCs funded? You talked about the investment. How are trauma recovery centers funded? You also highlighted, the type of support that folks are getting. What's the gap there versus what, the funding that TRCs are getting versus what the need is?
Absolutely. TRCs are the recommended funding level for a trauma recovery center is 1.2 million. Our trauma recovery center is 2/3 less funded than it really should be. And so these are conversations that we're having locally, state, and with our legislators, because this is it's not acceptable. It's not acceptable. So there is a funding gap for trauma recovery centers across the country. And I want to point out too that the particular intervention that we employ through the TRCs, there's research that indicates that it is 34% less expensive than traditional fee-for-service care. Our internal numbers put that at 40% at CITRIC, at the Central Iowa Trauma Recovery Center. And so it's saying that if you provide this comprehensive mix of supports, you can still get incredible outcomes. Our numbers show a 62% reduction in PTSD symptoms, 50% reduction in symptoms of depression. This is what's possible when you make this kind of comprehensive investment that gives you the clinical outcomes that are needed to move families forward, but it also gives you the cost effectiveness that many folks are concerned about, especially now. So the funding comes from state and federal dollars. We are funded through VOCA. We are funded through the State General Fund, through the Attorney General's office. So that's how our funding comes to us.
How can, Stacy, I'm going to give you this closing question regarding the funding. How can local, state, and federal investments scale up healing in the manner that matches the need?
Well, the ratio that Lenore and you are presenting in this report is a perfect example of what is needed in all communities. That we know that right now that the majority of victims don't have access to these type of services. And so a federal funding stream that would help with the sustainability of TRCs would really help to be able to scale up these services. And ideally, governments should be investing in services that they know work, right? And in services that can contribute to the sustainability of their communities and to public
Yes.
safety. We know these services, as well as the services provided by the other organizations on this panel, on this call, save millions of dollars, billions of dollars in terms of healthcare costs, in terms of the criminal legal system, in terms of other types of unnecessary services, that when you make this kind of investment up front, you're actually saving money in the long run, as well as creating safer and healthier communities.
Thank you for that. Thank you both for that. And we understand that there's a direct pipeline from unaddressed trauma to violence, whether that you're experiencing repeat victimization, whether you are coming in contact and being part of the justice system, whether you are experiencing substance abuse. There's a pipeline that exists there that trauma recovery centers work to intercede in and to stop. Thank you both for that. I want to transition now to the National Community Violence Intervention Guru. I want to transition over to Akila Sherrill. Akila, thank you for joining us. Tell us about the work that you do in the model, and how do we scale that, particularly as it relates to outcomes to stopping violence in communities?
Thank you so much, Shakira. Traditionally we talk about, public safety really as a function of law enforcement, right? You say public safety and people say police. And the reality is that, police are only one aspect of the public safety ecosystem. You literally can't have public safety without the public, right? And so our model is a place-based strategy, community-based public safety, in which we train residents in neighborhoods as public safety professionals, and we deploy them at key intersections in the community, right? One of the things that we use is data to inform our overall strategy. So in 2017 in Newark, when we launched the Newark Community Street Team, we discovered that 62% of the homicides in the city started out as as interpersonal conflicts, right? And so what it told us was that if we trained residents in communities and we provided them with conflict resolution and de-escalation strategies through a trauma-informed lens, that we could intervene and mediate conflicts to a peaceful resolve, and reduce violence and crime in neighborhoods long-term. And so in Newark, we have a three-pronged strategy: high-risk intervention, assertive outreach, and victims advocacy. These three systems function together as a unit in terms of actually being able to reduce violence and crime. Over the past 6 years, we've had a tremendous impact in terms of having 6 consecutive years in a row of decreases of homicide and overall violence. Our high-risk intervention team are highly trained in conflict resolution, mediation and de-escalation strategies. They're connected to dispatch in the city. So when there's a notification that comes across the police's dispatch, our high-risk intervention team receives that as well. And they respond to the scene. They don't never cross the yellow line. It's not a part of our protocol, but we utilize our relationships, because this is a relationship-based strategy, right? To talk to survivors, to victims in community. In many cases, we follow those family members to the hospital, where we run the city's first hospital-based violence intervention program. So we have 3 community health workers who are embedded in the trauma unit that can sit people bedside. And we provide safety planning, because an arrest doesn't always end the conflict, right? Sometimes it exacerbates it. It really requires long-term maintenance on these relationships, because we've seen 1,000 times, men and women who are engaged in violence might go to jail, do 10 years and come home, and that conflict is still living. The most dangerous time for a returning citizen in many cases is the first 6 months. Because a lot of times there are no services to receive them and to support them in terms of their healing journey, and also integrating back into community. Our assertive outreach work shows up as Safe Passage in the city. It's our forward-facing initiative. We employ about 27 individuals around 19 schools in the South Ward, making sure that our kids go to school safely and come home safely. mediating conflicts in between. School can be a place where, especially middle school and high school, where lots of, conflicts happen. Conflict is a healthy part of the human experience. We ain't trying to avoid that. But we do know that unresolved conflict actually is what leads to violence. The other important component is our victim services and victims advocacy piece. Traditionally in our community, Black and brown folks do not identify as victims. So therefore, we rarely are able to access victims' comp and victim services, through the city, right? The Alliance for Safety and Justice done a national report. We know that less than 20% of folks are actually accessing victim services and victims comp. And so our victims advocate, who are residents in the neighborhood, who are trained, victims advocates, basically do community walks, go door to door, talk to residents. We complete their victims of crime application. We follow it up all the way through the end. And even if in some cases, when the state denies our cases for things like contributing behavior, we partner with the Victims' Right Law Center to actually sue the state to make sure that survivors are actually receiving the services that they need in order to heal, right?
That's a lot of different variety and types of service and interventions. Can you share, one, Akilah, how you're funded, and two, how local, state, and federal investments can scale up so that we're living up to what the Scaling Safety Report is really calling for, how to invest so that we are stopping the cycle of violence?
We have a pretty diversified funding base, but in launching this work, it was philanthropy that came to the table. So just a shout out to Victoria Foundation and Prudential. Philanthropy actually seeds innovation, and gave us an opportunity to do a proof of concept in two particular neighborhoods in the community. And so once we were able to, do a proof of concept, we were able to access, public dollars. So initially we got a small grant from the city. Then we applied for BOCA dollars in the state through the AG's office and were funded. And then we applied for federal dollars and were successful at securing grants like CBCR, the Community-Based Crime Reduction Initiative, which is traditionally going to law enforcement. But because of our strategic partnership with law enforcement in the city, we were able to access those dollars with support from law enforcement, and at the same time, not share intelligence with them about some of the work that we're doing in the community because it's dangerous, right? But we work hand in hand as a partner. We see community-based public safety as a complementary strategy to policing and not an alternative. And so, we've have done a lot of advocacy in the city and in the state, to be able to access, ARPA dollars, American Rescue Plan dollars to support this work. We totally believe in this, in the scaling safety model that, hey, it is important that we utilize these ratios in order to beef up our work, right? Although we've had a huge impact in Newark, we're still, way, underfunded. And so some of the things that we're looking at just in terms of like what's needed, right, in order to kind of take us to the next level is training and technical assistance. It's a huge piece in terms of this work because a lot of our organizations, are born out of harm and out of hurt, and it's not easy to go from being a harmed and hurt person to, being charged up about doing something about violence in your community and then running a nonprofit agency.
That's right. That infrastructure support.
Yes.
Thank you so much, Akilah. I will ask one wraparound question once we get through, once every panelist speaks. But Akilah, you mentioned reentry and that time period post release that can be a challenge. I want to bring in Susan Burton, who runs just this amazing model that started out in LA that has grown across the country into this conversation, and really anchoring it around, a key piece that everybody needs, housing, right? So Susan, introduce us to your model. Why does your model contribute to reducing violence in communities? Let's start there. Like, what is it, and how do you feel it contributes to reducing violence or stopping violence in communities?
So when people are released from incarceration, they're released many times in crises, without housing, without stability, without support. So a new way of life picks up people as they're released at the gate. brings them into a community where they're welcomed and supported. And we have a non-punitive approach to supporting people as they come into our homes. And we provide services that are unique to the individual and with wraparound supports that is flexible enough to meet everybody's unique needs, from shelter, legal services, family reunification, mental and physical health care, substance misuse recovery, employment, and leadership development. We know that people who have been through systems have capacity to actually become leaders, as Aquila talked about, with support, technical assistance, and healing. They become leaders and ambassadors in the community for safety. Whereas if they didn't receive the services, they would be in crises and leaders in different ways, other ways. Shakira, in 2017, I published a book called Becoming Miss Burton. And I thought that women, incarcerated women, were the most important people that needed to read that book. So I went on a book tour exclusively for women inside of prisons and did book signings all over the country. I visited 64 prisons in 26 states, and did book signings. And the pain and despair in the women's eyes as I did book signings and the request for them to have a new way of life in their community got me to thinking about what I could do. I couldn't be everywhere to everybody, but what happened is I created a program called SAFE. And SAFE stands for Sisterhood Alliance for Freedom and Equality. And what I set out to do was to identify individuals across the nation that had leadership capabilities and wanted to replicate a new way of life's model. Shakira, 9 out of 10 of the people that we work with, women and the LGBT community, are successful with our model, with our individualized approach, structure and support and resources. So I began to train people to replicate our model. And I began to raise funds to support them in launching their models. So right now we are in 26 states. And we have, I'm sorry, 16 states with 26 sites of people replicating a new way of life's model. And we provide them with technical assistance. We provide them with a range of supports, from coaching, mentoring, development, capacity building, just so they can begin to stabilize their organization and their support. So thus far, we have trained 260 people, but we haven't had the capacity to support all those people to actually replicate, although there's a desire to get, to support people coming home. We provide, and what do? We transform the lives, and we scale the potential that people hold within them with just some supports. I have so many amazing stories of not only leaders in their community that have become, stand-up people who are guiding people to safety, guiding people to family reunification, repairing the harms that has been caused by mass incarceration. There's just so much potential here, and it's for less than half of the cost of incarceration. And the long-standing effects that it have, we just can't begin to calculate the way that harm has turned into healing. the way families have been repaired, the way stability has came into the community, the way people become real contributing tax-paying members of their community, and voices for safety, voices for justice within their communities. I'll stop there. I don't want to go on and on, but I feel so encouraged today by what we are all doing and the possibilities for tomorrow.
Love it. Thank you. Thank you all. Susan, I just wanted to flag this for you. This came up in the chat. T Braveheart wanted to thank you. She was among the incarcerated women you visited in Maryland prisons, and your book and your work helped her and many.
I'm so glad.
That
I'm so glad.
you.
Yeah.
Folks, please feel free to use the chat. We have a couple of questions here. Where have we seen partnerships happen organically that are not funded yet? So I know that each one of you have partnerships because of the cobbling together of resources that many of you have ingeniously figured out how to create. Where, can you talk a little bit about the partnerships that have existed? And again, if we could just really highlight before we answer that question, how each of you feel your model is reducing crime, is increasing safety and reducing crime. So let's do a real quick round robin on that, and then transition to the question around partnerships. I'm just going to go across my screen. Allison, the first is to you. How do you feel the TRC model reduces crime and increases safety? You're on mute.
I think one of the key things with the Trauma Recovery Center process is that it is more than just mental health that's provided to survivors of crime. We don't get stuck in the pathology of their trauma. We look at their whole lives. It's whole person care. And so we address their life stability so that they can focus on their treatment and help heal the family system overall. And so when you treat and help heal that head of household, you're improving the quality of life for that whole family. The children are in a healthier environment. They have a healthier mother or father or grandparent that is their caretaker. So we do it that way. And we get those results because we actually do measure their perception of their quality of life throughout the course of their treatment.
I'm sitting here thinking of what it would look like to multiply each one of these models in neighborhoods all across the country. Because of the impact that you reference, Allison, it's not just the individual, it's the family. It is, and we multiply that by multiple families in a neighborhood and entire communities. This is what scaling safety looks like. Stacy, can you answer that question? How is it that you feel that trauma recovery centers and scaling them would increase safety in communities?
Yeah, I think trauma recovery centers do that not only by supporting healing and recovery from one acute incident of violent crime, but TRCs also prevent all of the negative outcomes that we know are associated with unaddressed trauma. So preventing substance abuse, preventing homelessness, preventing re-victimization in the future, and preventing perpetrating violence against others, which we know are all potential outcomes and consequences of unaddressed trauma.
Yes.
Thank you for that. Akila, you have a question here. Could you explain how two things are true at once? Violence intervention programs have received more funding recently, but more resources are needed. So can you talk us through that? So while there has been an influx, there is more funding that is needed. Can you talk us through that? Why is that the case? Susan, I'm gonna go to you next.
So, the Biden administration has made the largest investment in the history, I think, of this country in terms of community-based public safety or community violence intervention. Just recently, they passed the Safer Communities Act, $250 million over the next 3 years. They've already been rolling out dollars through a racial justice lens through DOJ and several other the federal formula programs. So there's lots of investment coming. Here's the challenge, is that many of our community violence intervention organizations don't have the fiscal and programmatic infrastructure in most cases to receive these dollars. So this is why training and technical assistance is needed. So the White House launched the White House Community Violence Intervention Collaborative, in which I currently have the fortune and the pleasure to manage a 16 jurisdiction initiative to build the capacity of 52 community violence intervention organizations to be able to receive these types of federal investments. So we're scaling now. Community-based public safety has been around for 30 years. This is evidence-based work. And Shakira, I'll just say that in Newark, when we started our work, Newark was on the top 10 most violent city list for almost 50 consecutive years, and we started out our work in 2015 with 103 homicides. 5 years later, a few years later, after implementing our community-based public safety initiative, we've been below 60 for now 7 consecutive years, and law enforcement in the city, our municipal partners, they all credit, NCST and this, ecosystem that we've developed, that includes TRCs and HBIPs working collaboratively with reducing the violence and crime in the city. So it's been phenomenal, and it has a huge impact. And so we're advocating for more money for community-based public safety, more money for TRCs, more money for HBIP, because they work. They work.
Thank you for that. Those are pretty astounding results. Thank you for that. And that gets to that partnership question that was raised earlier. Susan, this question is for you. What would fully replicating your reentry model and scaling up for safety look like? How many people would benefit from your services? You're on mute.
Shakira, first let me say the point that Aquila made about training and technical assistance is key to allowing a community to build its safety social net and network, that folks in their community are the ushers of safety, and the folks on the ground are creating health healing for their own communities, not having other folks come into their communities, but owning and ushering that safety and healing within their own community, and it empowers communities. So what you asked me, how many people are affected?
If you were scaled up, right? So if you were to fully replicate the model and scale it up, how many people do you think would benefit from your services?
So, it's hard to even say, Shakira. We've trained 260 people, but it just ripples out when you have a child that's misbehaving or having pain and trauma in their classroom. That teacher or that whole school system is ran in havoc for this child. But when their mamas and the daddies come home and they're reunited, that child changes. So the numbers that could be reached, I can't even begin to say those numbers. Perhaps there would be less people even needing the trauma recovery center. There would be less violence. There would be more income into states when people become employed. It's just hard to even say, but we would like to replicate across all states this reentry model and decrease the crises of people that are coming home. Just for now, I'd like to actually say the states that we're in: Alabama, Arizona, California, Georgia, Illinois, Indiana, Michigan, Mississippi, North Carolina, Nebraska, Nevada, New York, Oklahoma, Pennsylvania, Texas, and Washington. And, to my surprise, even, we went international. We have a site in Kenya that is replicating, and a site in Uganda that's replicating. We know all four of us here on this screen know that what we're doing creates safety in our community, creates healing and transforms the effects of trauma, and makes our communities healthier, safer, and more prosperous. For those that have traditionally and historically been left out, have not been able to actually receive supports and services. And what we do is actually humanize people, that they feel that they count, that they're important, and that they're recognized, and that their needs are met. And that can just be transformative when we talk about the esteem of people, the meaning and the purpose that they have, because we know prisons have stripped that from people. They come home so harmed. And what we do is let them know that they matter, their lives matter, and their futures matter.
Susan, thank you for that. And then even thinking about the introduction of prisons into this conversation, Allison, I want to start this off with you. Talk a little bit about the cost effectiveness of the TRC model, but really broadly think about that, each one of you, the cost effectiveness of your models versus a traditional criminal justice system infrastructure. For example, a prison, depending on the state, can cost about $150 million to operate. Imagine $150 million for trauma recovery centers. Imagine $150 million for community violence intervention. Imagine $150 million for mental health supports. Imagine $150 million for safe housing for people returning home from prison.
Oh my God, I got excited. I'm sorry. I had to jump in here, Allison. That imagination, I just got excited, but you take it, Allison.
Well, trauma recovery centers, and we're talking about cost effectiveness. We have this idea that if you provide these high level comprehensive services on the front end, that it's going to be too expensive to maintain. Well, that's just not true. Because when you make that investment on the front end, as that person, we have seen over the course of a year's time working with our clients that they don't need as much. They're getting better. One of the things that we're able to do in the Trauma Recovery Center model is we have a very specific interval assessment that we conduct on a regular basis. It's not just providing mental health. Most often in a traditional mental health setting, they don't revisit the intake process. It's done on the front end, but it's not reintroduced throughout the course of treatment to actually measure progress in very specific areas. So we conduct interval assessments throughout the course of treatment to show the client their progress. It's important for them to see, I'm getting healthier, I'm getting better, and sitting down and having that consultation with them. But what we have found is that clients are less reliant on other state-supported systems of care. They don't ask for as much in terms of supports that would be available to them through crime victim compensation. They're returning to work. They're maintaining their housing because of the life stability emphasis that we focus on. Because when they come to us, we measure life stability, which includes finances, housing. It includes medical costs that they have. It includes their transportation needs. It includes a whole host of things that affect all of us in terms of our daily lives. And so when you address those needs for individuals and they're able to maintain their employment as well, because we negotiate with employers regarding individuals being able to maintain their jobs. Because if a traumatic incident has happened with you, sometimes people are not able to maintain their employment because they're so traumatized by what happened to them, they are terminated. And so we actually create that space with many employers to maintain their their jobs. And so what we are seeing is that clients get better much faster. And so then it's kind of like you provide this whole safety net of support for individuals, and then they're able to re-engage in terms of their social networks, their housing, their work, all of those different things. They're healthier. It's a healthier individual that is able to go back to their lives to the degree that it's possible for them individually. So it is less expensive because they don't have to incur inpatient treatment, which is extremely expensive for individuals. They are able to, let's see, I'm trying to think of a very specific case. For some of our clients who are disabled, they require more comprehensive care. So we're able to address those needs without them having to be maintained in a facility, for example.
Wow.
We can address environmental modifications that some of our clients have injuries. So if we can address and make their home safe for them to be, we can address those situations for them. So that's less costs that the state would have to incur because those individuals may be on Medicaid or something like that, but they don't have to take that in. We're able to contain them, support them so that they're safe in their own home.
So essentially, this is about when we're talking about these investments on the front end, right? We're talking about a domino effect of savings. We're talking about a domino effect of stability. We are talking about a domino effect of safety. And the investments that we have currently, right? The investments that are traditionally have been the same investments for the last 30, 40 years are back-end investments. And we see how that's going for us, right? Let's try something different. Let's try something that works. I want to thank each and every one of you for joining us, for sharing your expertise. We know that you're extremely busy people. You're really, when we think about the work that you're doing, and we multiply that by the families, by the children, by the neighborhoods, you are having a generational impact. So I want to thank you on behalf of the Alliance for Safety and Justice for taking the time and for just the sacrifices, devotion, and the heart that you bring into this. For all of you who are joining us, who want to learn more about the safety gap and the solutions that we're elevating in our publication, I urge you to visit our website. You also have our the report is up here in the chat for all of you all to download and take a look at. Yeah, let's do this. Let's invest on the front end. Let's scale it up, because the goal here is not just investing just to invest, because that's the way that we've been doing it. Our goal should always be stability. Our goal should always be safety. Unfortunately, many communities across this entire country have no idea what that looks like.
Shakira, can I just say this really quickly?
Sure.
I know we're going to close, but I was thinking a little bit about what Akila said early in his conversation, in his discussion, and that is about how we are reimagining what safety looks like in communities across the country. All of these different prevention and interventions that we've talked about today is about looking at safety, public safety, in a new way that is comprehensive, that is compassionate, and that delivers on behalf of survivors who need our help. So I just wanted to say that.
So Allison, Stacy, and Aquila, I think that we have went beyond reimagining. We have to actually begin to apply the solutions and what we imagined. We're actually doing it. And to have the, investment and support, all of our outcomes are documented. and to have that recognized and invested in is what should be happening. But we're beyond reimagining. We're doing the darn thing.
Doing it. We
Right.
just need to scale it up. We need the.
Yeah. And I just want to tell you all that, you know, I'm honored to be a part of this conversation with you today. I am so grateful to ASJ for the work that they've done and how they are, you know, looking and recognizing people that traditionally are just not looked at or recognized, and bringing this whole different a light on survivors and who survivors are. So I'm just really pleased. You all have made my morning. I feel like I'm just bubbly. It's hard to get me bubbly. So I'm just honored to be with you all today.
Thank you. Thank you.
Likewise.
Yes, likewise. Thank you all so much. This is really powerful.
Yeah. All right.
All right. For those who have joined us, you will get all the resources that we have shared in the chat. You will get those via email. Thank you for joining us. And stay tuned. This is just one of many.
Yes.
Till
Shout
next
out to the National Network for Shared Safety. You know,
Yes.
big work happening.
Yeah.
Thank you. Thank you, everyone.
Thank you very much.
All right. Bye-bye.